Alright, today we'll talk about antidepressant pharmacology. Antidepressant pharmacology. So we need to know what depression means. What is depression? Now, depression is an example of a mood disorder. It's an example of a mood disorder that is characterized by intense sadness, despair, lack of pleasure. Are you there with me? So it's an example of a mood disorder. In fact, a low mood disorder, what is called, characterized by intense sadness, despair, lack of pleasure, and to the extreme of it, the patient will be having what we call suicidal thoughts. Okay, now in terms of pharmacology, there are certain hypotheses that tries to explain the reason for depression. There are certain hypotheses that tries to explain the reason for depression. So hypothesis explaining depression. That's what we'll look at now. Please don't mind my writing. Hypothesis explaining depression. Now, basically, there are three of these hypotheses that try to explain depression, of which the first one is what we call the amine hypothesis. What do we call the amine hypothesis? The second one is what we call the neurotrophic hypothesis. And the last one is called the neuroendocrine hypothesis. Okay, now basically, with the help of these three hypotheses, we are able to say, oh, this is what is happening in a depressed patient. You understand? Now we'll start with the first one, the amine hypothesis. Before we start with that first one, let me just tell you this one. This one is also called the brain-derived neurotrophic factor hypothesis. That's what it means. Basically, we're trying to say, oh, this factor is lacking in this patient. That is the reason why they are having depression. Okay, so back to the amine hypothesis. The amine hypothesis is the one that is well known and well characterized. Now, by the amine hypothesis, they state that the reason why patients are being depressed is because they are having low levels of amine. Because of low levels of amine, that's why they are being depressed. Now, this amine, we are talking about things like dopamine is an amine, norepinephrine is an amine, either with me, serotonin is an amine too. Okay, so they try to explain it majorly around this, majorly serotonin and norepinephrine, and also dopamine in some cases. So they're trying to say, oh, due to low levels of amine, that is the reason we are having depression in the patient. Now did they come about this? They realized that certain patients who took drugs like certain hypertensive drug like rezepine is an anti-hypertensive drug. And how does it work? It tends to block the vesicular uptake of monoamines. So if, for example, we are synthesizing a monoamine in a nerve terminal, we need to, let's say this is the monoamine, we will need to package that monoamine in a vesicle. Now, the function of rezepine is that they block the vesicular uptake of this monoamine, leaving this monoamine to be destroyed by monoamine oxidase. So that is the idea. So when you give patient rezepine, it blocks the vesicular uptake of monoamine, thereby allowing monoamine to be destroyed by monoamine oxidase. This will now lead to a reduction in the levels of monoamines like norepinephrine and serotonin. When this happens, yes, you are treating the hypertension by giving this medication, but over time it was discovered that such patients who took this medication they become so depressed, and so they even started committing suicide. So this Rizepin of a drug is no longer in use again. I brought it here in order to explain how they actually came up with the fact that, oh, due to low levels of amine, that's why patients are being depressed. You get, was as a result of this Rizepin. Then again, certain beta blockers that work centrally, they also in a way aggravate depression. Beta blockers that work centrally, they also aggravate depression. As a beta blocker, you are preventing the action of, like, you are working at the receptor level, and you are not preventing the action of this amine. So by so doing, it can also lead to what? Depression. And again, drugs that are alpha 2 agonists and also centrally acting. So we have beta 2 antagonists or blockers. Let me just put blockers: beta 2 blockers and alpha 2 agonists. Beta 2 blockers and alpha 2 agonists. Okay. These ones also have been discovered to aggravate depression. They've also been implicated in aggravating depression in patients. Now, also patients that are taking isoniazid, they also discovered that they tends to feel good. They used to have good mood. I understand my point. The reason is because isoniazid has been discovered to be, isoniazid is a monoamine oxidase inhibitor. So patients who took isoniazid, they have a elevated mood because what? You are inhibiting the enzyme that destroy monoamines. So all these ones are all what tries to explain the amine hypothesis. Okay, these are all what tries to explain the amine hypothesis. Now the other hypothesis is the neurotrophic hypothesis of depression. Basically, this one tells us that certain growth factors are needed for nerve growth, and a good example is the brain derived neurotrophic factor. Brain derived neurotrophic factor is needed by what? By nerves in order to develop properly. And the particular area of the brain where this is usually needed mostly, as it pertains to depression, are your cingulate cortex, and also your hippocampus. Okay, so that is areas where this brain derived growth factor has been found to play a major role. That is to say, if you are having low levels of this brain derived growth factor in these areas, then you should expect to come down with what? With depression. Also, the last theory that tries to explain depression again is the neuroendocrine factor. Now this one we are trying to see, how does cortisol level affect depression? And it has been found that patients with high levels of cortisol, cortisol is a stress hormone, high levels of cortisol tends to be depressed. Then again, it's also discovered that the patient who took steroids are also said to have mood disorders also, you get, a cognition deficit. So patients, the last one, the last hypothesis now is the neuroendocrine hypothesis. Neuroendocrine hypothesis. This hypothesis basically tries to explain that, for example, let's say cortisol, like I explained, patients who are having stress, who are stressed, and they release cortisol, you can explain that, this is high level of cortisol, they tend to experience depression. Also, patients who are on steroids, they also tend to have mood disorders like depression also, you understand, and cognitive deficit. However, for the hypothesis in depression, the main one, like I explained, is the amine hypothesis. That is where majority of your drugs are coming from, your monoamine oxidase, your tricyclic antidepressants, your SSRIs. I get my point. Your SNRIs, all those ones, they are all coming from the monoamine, the amine hypothesis. We'll look at them. So I'll just quickly drop them now. So drugs now are then developed to work with this hypothesis, and there are about 4 classes of such medication. So we have classes of drugs that are used in depression as it relates to this hypothesis what we'll discuss. So there are 4 major classes. The first one here is the monoamine oxidase inhibitor. So we'll just write them, then we'll call it a wrap for this video. The first one is the monoamine oxidase inhibitor. The second one, what we call the tricyclic antidepressant. The tricyclic antidepressant. Spelling way again. The tricyclic antidepressant. Then the third one is what we call the SSRI, which is the selective serotonin reuptake inhibitor. Then the fourth one is what we now call the atypical antidepressant. Atypical antidepressant. Okay, so in our next video we'll continue from here, majorly with the monoamine oxidase inhibitor. Now from this video I'll be able to explain to you what depression is and what are the theories in depression. The theories in depression, your amine theory, your BDNF theory basically, and your neuroendocrine theory that tries to explain it with cortisol. And also, in addition to that neuroendocrine, it has also been linked that thyroid hormone, low levels of thyroid hormone, has roles to play in depression. Okay, didn't mention it before, but mention it now. All right, thank you.